The World Health Organization has reported an alarming surge of Ebola cases in the Democratic Republic of the Congo, reaching 282 confirmed infections. Just as the U.S. prepared a quarantine plan for exposed individuals, a court halted those measures, raising urgent questions about public health safety. Here's what you need to know. The recent court ruling regarding the quarantine plan has left health officials in a challenging position. This decision has ignited significant debate about the balance between individual rights and public health safety, reflecting broader societal tensions. The ruling could be appealed, offering a potential pathway for the reinstatement of the quarantine measures. Such a move would empower health officials to act swiftly to contain the outbreak, especially considering the highly contagious nature of Ebola. In contrast, if the ruling remains in place, officials may need to explore alternative strategies, potentially resulting in a fragmented response to this crisis. Historically, the Democratic Republic of the Congo has grappled with Ebola outbreaks, often prompting international support and intervention. The nation has faced numerous health challenges, highlighting the importance of robust health infrastructure. Experts suggest that if cases continue to escalate, we may witness a coordinated global response similar to previous health emergencies, as observed during the West African Ebola outbreak. The implications of this situation extend beyond the DRC. Any signs of the virus spreading could lead to travel restrictions and heightened alertness worldwide. The potential for increased cases raises critical questions about resource allocation and the ability of local health systems to cope with a surge in infections. With health authorities on high alert, updates regarding the court's decision and subsequent public health policies will be crucial in shaping the response. As we move forward, it is imperative for policymakers to consider not only the immediate health implications, but also the long-term effects on public trust and legal frameworks. The next few days will be pivotal in determining how effectively we can navigate this complex crisis while safeguarding public health and ensuring that appropriate measures are in place to prevent further outbreaks. The current crisis has deep roots stemming from previous Ebola outbreaks in the Democratic Republic of the Congo, DRC, and surrounding regions. The last significant outbreak occurred in 2022, prompting a series of containment measures and international cooperation efforts. Despite these efforts, a resurgence of the virus has occurred, driven by a combination of factors, including insufficient vaccination coverage and delays in public health responses. Authorities had been preparing to implement quarantine measures after reports surfaced of individuals exposed to the virus during travel to Kenya. This failure to contain the virus earlier this year can be linked to logistical challenges, such as inadequate healthcare infrastructure and public hesitancy toward vaccination, fueled by misinformation. Historical precedents show that rapid responses can be effective in curbing outbreaks, yet this time, legal challenges faced by health officials have added layers of complexity absent in previous crises. Key players, including public health officials and legal authorities, are influenced by past experiences, which have instilled a cautious approach in their decision-making processes. The impact of this crisis extends beyond immediate health concerns. It raises questions about the efficacy of global health systems and the need for robust emergency protocols. The current situation serves as a critical learning point for future health emergencies, highlighting the importance of swift action and public trust in health initiatives. Moving forward, it is essential for health authorities to address the gaps in vaccination outreach and to foster community engagement to combat misinformation. Strengthening logistical capabilities and reinforcing legal frameworks will also be crucial in ensuring a timely response to future outbreaks. As the situation progresses, a renewed focus on collaboration and transparency will be vital in rebuilding public confidence and preventing further outbreaks. The halted quarantine plan in response to the recent Ebola outbreak has raised significant alarms among health experts and policymakers alike. This decision comes at a critical juncture as the Democratic Republic of the Congo, DRC, is witnessing a surge in Ebola cases, prompting concerns that the situation could escalate into an international health emergency. With over 10 million individuals traveling to and from the DRC annually, the potential for rapid cross-border transmission is alarmingly high. Historical precedents, such as the West African Ebola outbreak in 2014, highlight how quickly such viruses can spread when containment measures are inadequate. The implications of this halted plan extend beyond immediate health concerns. Health officials are now forced to reevaluate their strategies in light of a court ruling that could delay essential interventions. This uncertainty places communities both in the DRC and the U.S. at heightened risk, as timely responses are crucial in managing infectious disease outbreaks. The erosion of public trust in health authorities is another concerning consequence. Citizens witnessing legal obstacles to effective health measures may begin to doubt the system's capability to safeguard their well-being, leading to increased anxiety and possible non-compliance with future health advisories. Furthermore, the economic ramifications of this situation are profound. Should travel restrictions be implemented, or if outbreaks spread further, businesses in the travel and tourism sectors could face devastating losses. The implications of an uncontrolled Ebola outbreak extend beyond immediate health crises. They threaten economic stability in regions already struggling with poverty and infrastructure challenges. Looking ahead, it is crucial for health authorities to engage in transparent communication and proactive measures to restore public confidence. Collaborative efforts among international health organizations, governments, and local communities are essential to contain the outbreak effectively. As the world becomes increasingly interconnected, the need for robust public health systems is more pressing than ever. The outcomes of these events may not only shape local public health responses, but could also redefine global health security frameworks for years to come. The next few weeks will be vital in determining the effectiveness of the containment strategies employed in this escalating crisis. On June 2, 2026, the World Health Organization reported a dramatic increase in Ebola cases in the Democratic Republic of the Congo, DRC, with the total number of confirmed infections reaching 282. This sudden spike in cases has raised alarms not only in the DRC but also across the globe, as Ebola is a highly contagious and lethal virus. In response, U.S. health officials quickly formulated a quarantine plan aimed at individuals who were potentially exposed to the virus in Kenya, a neighboring country of the DRC. However, this plan was abruptly halted by a federal court order, raising significant concerns about the effectiveness of containment measures. The court ruling, announced late yesterday, emphasized the need to reassess the legality and logistics of quarantine protocols, causing immediate uncertainty among public health officials. This legal intervention has triggered a wave of panic and confusion as the number of cases in the Congo escalates. The most shocking aspect of this situation is the timing. Just as U.S. health authorities were poised to act, legal barriers emerged, putting public safety at risk. This incident is particularly striking because it showcases how swiftly a public health response can be impeded by legal systems, contrasting sharply with previous Ebola outbreaks that were managed without such judicial interruptions. Historically, rapid response protocols have been implemented without the same level of legal scrutiny, allowing for timely measures to combat the virus. The implications of this ruling extend beyond immediate health concerns. They raise questions about the balance between individual rights and public safety in times of crisis. As the DRC grapples with escalating cases, the U.S. must navigate complex legal waters to protect its citizens. The outlook for containment remains uncertain, and health officials are calling for a reevaluation of existing laws governing quarantine. The potential for further outbreaks looms large, emphasizing the need for a coordinated response that prioritizes both legal frameworks and public health imperatives. Moving forward, it is crucial for policymakers to collaborate with health experts to develop robust strategies that ensure both the safety of the public and adherence to legal standards. As we consider the implications of this situation, how far are we willing to go to protect public health in the face of legal challenges? Share your thoughts in the comments below, and don't forget to subscribe for daily deep dives into critical news stories.